Are you concerned about heart health? Have you ever heard a doctor mention something called an S3 heart sound and wondered what it means for you or your loved ones? Understanding heart sounds can feel overwhelming, but knowing more about them could be the key to better heart health. Let's dive into the fascinating world of heart sounds, particularly the S3 heart sound, and discover why it matters. What are heart sounds? When your heart beats, it produces sounds, much like a drum creates beats. These sounds are crucial indicators of how well your heart is functioning. Typically, a healthy heart makes two main sounds, known as S1 and S2. Think of these as the rhythmic loop dub that accompanies each heartbeat. But what about S3 and S4? Heart sounds occur as blood flows through the heart chambers and as its valves open and close. The heart sounds are like musical notes played by your heart, signaling the ebb and flow of blood. S1, loop. This sound occurs when the heart's mitral and tricuspid valves close, marking the beginning of the heartbeat. S2, dub. This follows when the aortic and pulmonary valves close, signaling the end of the heartbeat. But what happens when a third sound joins this duet? That's where the S3 heart sound comes into play. What is the S3 heart sound? The S3 heart sound is like a surprise guest at a concert. It happens right after the S2 sound, creating a rhythm reminiscent of a galloping horse. Doctors often refer to it as a ventricular gallop, a name that captures its lively, low-frequency vibration. This sound occurs when blood rushes into an overfilled left ventricle during early diastole, the heart's relaxation phase. Imagine a large wave crashing against a shore. That wave is like blood flowing into the ventricle, creating the S3 sound as it strikes the ventricle's wall. You can typically hear the sound at the cardiac apex, the tip of the heart, located to the left of the sternum, between the fourth and fifth ribs. Why does the S3 heart sound matter? Now, you might wonder, what does it mean if you or someone you know has an S3 heart sound? The answer isn't straightforward. It can vary widely among individuals. One normal variation, in some people, especially children, pregnant individuals, or well-trained athletes, the S3 sound is perfectly normal. It's like a healthy heart singing its unique tune. Two potential concerns, however, in other cases, the S3 heart sound may indicate potential heart problems, particularly systolic heart failure. This condition occurs when the heart cannot pump blood effectively, leading to symptoms like fatigue, shortness of breath, and fluid retention. The S3 sound serves as an early warning sign, much like the first drops of rain before a storm. What causes the S3 heart sound? While the S3 sound may be normal for some, it can indicate issues in others. Let's break down the possible causes. Increased blood volume. When the left atrium fills with excess blood, it leads to increased pressure in the left ventricle, creating that distinctive sound. Heart conditions. Congestive heart failure can lead to the S3 heart sound due to poor heart function and fluid buildup. Mitral valve issues. Problems with the mitral valve can cause regurgitation, where blood leaks backward, further complicating the heart's ability to pump effectively. The mechanisms behind the S3 sound remain somewhat mysterious. Traditional thinking suggested it was merely blood rushing into an overloaded ventricle. However, recent research indicates that the diameter of the mitral valve annulus, the area where the left atrium meets the ventricle, may also play a significant role. Understanding the fourth heart sound, S4. To give you a broader perspective on heart sounds, let's also discuss the S4 heart sound, known as an atrial gallop. This sound occurs when the atria contract forcefully to push blood into a stiff ventricle. Unlike the S3 sound, which can be normal, the S4 sound almost always indicates a heart condition. Think of it as a warning bell, signaling potential issues with the heart's ability to fill properly. Listening for heart sounds. If you've ever had a doctor listen to your heart with a stethoscope, you've experienced firsthand how they detect these sounds. Doctors can hear the S3 heart sound most easily during a physical exam, particularly when the patient is lying on their left side, which brings the heart closer to the chest wall. Detecting the S3 sound can be challenging, as it's often subtle. It takes practice, a trained ear, and sometimes the right conditions to hear it clearly. When to seek help. If an S3 heart sound is detected, the next steps depend on the individual's overall health and any accompanying symptoms. Here's a quick checklist to help you gauge when to seek medical advice. Fatigue. Are you feeling unusually tired or weak? Shortness of breath. Do you find it hard to breathe, especially during physical activity or when lying down? Swelling. Is there swelling in your legs, ankles, or abdomen? If you answered yes to any of these questions, it's wise to consult a healthcare provider. Remember, early detection and intervention are crucial to maintaining heart health. Treatment options. If an S3 heart sound is linked to a heart condition, such as congestive heart failure, there are various treatment options available. While these options can't reverse existing damage, they can significantly improve quality of life. 1. Lifestyle changes. Adopting a heart-healthy lifestyle is vital. This includes maintaining a moderate weight, eating a balanced diet rich in fruits, vegetables, and whole grains, increasing physical activity tailored to your ability. 2. Medications. Depending on the condition, doctors may prescribe ACE inhibitors, help relax blood vessels and reduce the heart's workload. Beta blockers, lower heart rate and blood pressure, improving heart efficiency. 3. Surgery. In more severe cases, surgical options may be necessary, including coronary artery bypass, creating a new path for blood to flow to the heart. Heart transplant, replacing a damaged heart with a healthy one. Valve replacement, fixing or replacing a faulty heart valve. 4. Devices. Some patients may benefit from devices such as implantable cardioverter defibrillators, monitor and correct irregular heartbeats. Cardiac resynchronization therapy, improves the timing of heart contractions. Conclusion. In summary, the S3 heart sound is a critical indicator of heart health that can mean different things for different people. While it can be normal for some, it can also signal potential heart problems, especially in those with conditions like congestive heart failure. Understanding heart sounds empowers you to take charge of your heart health. By recognizing the signs and knowing when to seek help, you can play a proactive role in maintaining a healthy heart. So, the next time you hear your heart beating, remember that each sound tells a story that could lead to a healthier, happier you.